Hello, everyone, and welcome to Shealth AI podcast series. Today, we are in the vibrant city of Bali hosting an annual medical conference in association with Bali Medical Tourism. I'm an Neri merchant. I'm handling the finance and operations of Shealth AI, an XVC tech portfolio company. Today, we will be here with a lot of hospitals, around 70 hospitals and 10 diagnostic clinics attending our annual medical event. But before much ado, let's just focus on what is Shealth AI. Shealth AI is an AI powered healthcare teleradiology company committed to transforming the way healthcare is delivered. Our mission is simple to make quality healthcare more accessible, efficient, and connected through responsible use of AI. Our platform combines intelligent workflow automation, advanced imaging solutions, private secure cloud technology, and telereporting capabilities to help hospitals and diagnostic centers improve efficiency, reduce turnaround time, and thereby enhancing patient care. We believe AI should empower healthcare professionals, not replace them, by enabling clinicians to make faster, more informed decisions while maintaining the highest quality of standard and patient safety. At Shealth AI, data privacy, security, and regulatory compliance are at the core of everything that we build. We work closely with healthcare providers, governments, and industry partners to develop scalable digital solutions that address real world healthcare challenges. Today at our conference, we have over 70 hospitals attending the event, privileged with the hospital owners, doctors, clinicians, and of course, chaired by Dr. Patra, who is the Chief Medical Tourism Officer here in Bali. Dr. Patra has a respected track record in the field of healthcare and medical tourism. His work has focused on strengthening healthcare ecosystems, improving patient access, and advancing international collaboration in healthcare. As we all know, medical tourism is evolving rapidly, and patients today are looking not only for world class clinical expertise, but also seamless digital experiences, faster diagnostics, transparent case pathways, and confidence that their medical data is secure. Artificial intelligence and digital health are becoming key enablers in delivering that vision. Now, without much ado, let's just start our podcast with Dr. Patra. Dr. Patra, thank you so much for organizing this amazing conference, and thank you so much for taking the time out to do a short podcast with us.
You're welcome. Okay.
Yeah. So, Dr. Patra, before we get into more details, could you tell our audience about how your journey has been and what inspired you to focus on medical tourism?
Okay. So thank you very much for your time. First, that my experience before, I'm as a chairman of the hospital, government hospital, and then after that, I'm working in the private hospital. I'm looking that Bali there is a special location because we are as a tourism destination. So there are many foreigners coming here, including the local people from other provinces coming to Bali. And one of the problem is about the health condition. So my experience before is only looking that the people who coming to Bali, if they have the health problem, so they come to the hospital. Before my hospital, not good enough preparation. So many people will be referred to outside.
Yeah.
And then after that, we do something to make our services getting better, including in their technology. Yeah. Because this is about the trust.
Yeah.
Yeah. So we are now looking at Bali, when there are many people coming and getting more and more coming to Bali.
Yeah.
It's good for Bali, for economics.
Yes.
But for the health sector, because the number of the hospital and the large of the hospital is not so much, so we make that the services must be a good quality, patient safety, and in the good quality, one of the criteria is the standard is about the response time. Yes. And the second, number of the specialist doctor in Bali is not so much, and the distribution is not so good. Yeah. So we looked at now because there is in technology, there is AI system.
Yeah.
So I looked at this is Bali need for the system like this.
Yes.
Because once again, Bali now, the traffic is, we call that is not good enough. Our government can be at the road and etc. So I think that to give faster services in health sector, special in emergency case, I think that AI system must be here in Bali. Yeah.
That's something very interesting that Dr. Patra just mentioned about having lesser wait times, lesser response times, and even in case of unavailability of specialist doctors, it needs to be ensured that the patients are treated in the right manner, in the right time, with the correct diagnostics. Now, since you've mentioned about AI and the impact that it will create, what I want to know is that Bali keeps getting a lot of tourists, which is enhancing medical tourism.
Yeah.
And of course, our goal here is to ensure that from everywhere within Indonesia, we ensure that, a lot of doctor availability is there, a lot of technology, digital first healthcare is there. So where do you say AI and digital health, especially teleradiology, which Shealth excels in the next 5 years, and how does it help Bali?
Yes. So for the information, before I have experience when to looking the hospital in Singapore, in Malaysia, in Japan, and etc. So I looked at they call about the smart hospital. Smart hospital is when that not only with the doctor, including the technology. Yeah. So I looked at this is good enough for the first in health sector. There is we call second opinion. This is the right of the patient. So before we are in Bali, only using the local doctor.
Yeah.
If the patient would like to have a second opinion, they must be going out from the hospital and they do by themselves. But now by AI, I look that it can be prepared in the hospital, so they don't going anywhere and using the AI to make a second opinion. And the second, we looked at for the health insurance. This is about the trust. Yeah. I looked at in Bali, there is a hospital. They have connected with the branded because so the health insurance puts the patient coming there.
Yeah.
Yeah. So this is, I looked at not only about the doctor, but including the technology, the system. I think that if it's health insurance have attention for that.
Yes.
Yeah.
Yes.
So this is, I looked at, and I hope that in Bali, start from now, we inform about the AI system.
Yeah.
Our government is already to tell about this system, but I don't know exactly how the program and etc.
Yes.
So why I asked with this Health AI to coming to Ministry of Health, because in Indonesia, we start using the electronic medical record. One of the program is, or the module is about the radiology.
Yes. Yes.
Yeah.
Yes. So thank you, Dr. Patra. You've explained in great detail about how AI and digital tech would actually enhance patient healthcare. Now, you mentioned about, Shealth making an impact here within Bali. And over the last couple of weeks, our team has actually met the Ministry of Healthcare, and we are going to host Dr. Patra tomorrow as well.
Yeah.
What I would like to know that from your perspective, how Shealth would make an impact here in Bali, and what do you think are the resources, or what do you think the tech we need to evolve in order to make an entry into the system and ensure it is at the core of ministry at what Ministry of Health wants?
Yes. So in my opinion that Shealth AI have a product or program.
Yeah.
I'm looking that this is good. And then the second, why we ask to communicate with our authority as a Ministry of Health, So we are in Bali. It's depend on the authority, and I hope that we give Shealth AI to communicate with our members, some of the hospital, uh, to looking our resources, your program. We call that integration. Between what I have in Bali and your program. Alright. And I look at this is to make Bali more classic. Yeah. Because once again, as you know that in Bali, our hospital is not so good. It's only 100 beds. But we have already pushed the hospital make a center of excellence. For to make the diagnosis of the patient is important for the radiology system. And once again, I look that this is time for Bali to increase the quality of services. Because once again, I don't want in Bali only the national standard. We would like to be the international standard. So what is happen in the other country? In the we look at in the what is the modern country, we would like to adopt.
Yes. Thank you, Dr. Patra, for your insights and for all the suggestions that you've given for Shealth AI. I truly appreciate your wisdom that has been accumulated over the last couple of years. And to everyone listening to this podcast, it is really clear that the future of medical tourism extends just beyond attracting international patients and tourists. It's about building healthcare systems that are connected, more efficient, secure, and more patient-centric. Technology, responsible AI, and strong public-private partnerships will all play a major role in achieving that in the future. And we at Shealth AI are at the forefront of that. We are really excited to be here within the Indonesia market. And please stay tuned to everyone seeing this podcast. We are going to give you short bites from everything that's happening behind the scenes at the event here on 10th of July in association with Bali Medical Tourism. Thank you so much. Signing off. See you next time.